Hello, I'm here with Dr. Seth Berkley. He's the CEO of Gavi, the Vaccine Alliance, which is the leading global initiative to provide vaccines to developing countries around the world. And I want to ask, particularly we're at a conference on universal health coverage. And Gavi is a very targeted mission here. But how does this advance universal health coverage around the world? And what's the intersection between Gavi and this idea to push UHC?
Of course, there's always a debate between vertical and horizontal, and the truth is we need both. If you look at immunization, it is the single most delivered intervention around the world. So today, we have the highest coverage ever. 86% of children in the world receive the third dose of a DPT-3 containing vaccine. And so that means 14% don't, and that's what we have to work on. But vaccines don't deliver themselves. So by reaching out to the unreached, what we're doing is building the supply chain, building the systems for data and surveillance, building the healthcare people who can provide services in these settings. And of course, all of that builds those systems. And we calculated that in just the Gavi countries, we have about 350 million encounters each year with the healthcare, with the primary healthcare system by families. And so that's about 1 million per day, the perfect opportunity to extend universal coverage.
So there's a portion of the funding that's going for Gavi is building up these structures that are being used in other interventions as well. Is a fair way to understand that.
Absolutely, and the important part, of course, is that it's by building those systems around an intervention that is the most cost-effective intervention, that is a prevention intervention, that ultimately allows those systems to be built for other activities as well.
Okay, well, thank you very much. We're glad you could be here with us today.
Thank you for having me.
Appreciate it.
Thank you.